Thank you for the introduction by the host. Let's begin. I'm the Dr. Tao Wu from the Shanghai Taikang BYBO Dental Hospital. It's my honor to present my 1-hour lecture here. The title of my lecture is A Novel Clear S8-SGTB, Correcting Severe Class 2 Jaw Discrepancy. A brief introduction of myself. I'm a DDS and a PhD orthodontics. I'm a key member of the Professor Gangshen orthodontic team and Vice Dean of Shanghai Taikang BYBO Dental Hospital, a committee member of Shanghai Orthodontic Association, and the instructor of Treat Merrifield Foundation in China, a fellow of the World Federation of Orthodontists, and the Smarty GS major expert. I graduated in the 4th Military Medical University in the 2000 year. And after graduate, I worked in the Department of Orthodontics in our university. Our university is very famous in the dental area in China. So after 2016, I quit the army and joined the Professor Gangshen orthodontic team from 2017 to now. Here's a video about our dental hospital. Our dental hospital located in the center of the Shanghai city. The area is more than 8,000 square meters. It includes 3 floors. Our orthodontic center is located in the 6th floor. This is Professor Gangshen. The professor is near to 59 years old. He worked more than 4 days per week. This is me. We have more than 150 patients per day, but in the weekend, the patient will be doubled. This is another famous doctor, Dr. Xu. He is an expert in the lingual orthodontics. He has more than 200 lingual orthodontic new cases per year. In addition to the clinical works, we also have the 2-year orthodontic training program. So a lot of doctors from China will come to our hospital and learning from us. Okay, this is our hospital. I warmly welcome you to our hospital if you come to China. Okay, this is a lecture overview. The lecture divided 3 parts. The first part is what is a Smarty S8-SGTB and the indications of S8-SGTB. The second part is why Smarty S8-SGTB therapy was stable. The last part is how Smarty S8-SGTB works. So let's begin. So what is the Smarty S8-SGTB? Let's from the case 1. It's a 28-year-old male. His chief complaint is a deficient lower jaw and crowding. The intraoral manifestation show the crooked teeth and the 3 depths. So what is the 3 depths? Let's see the patient 3D oral scanning. In the front of the view, we can see the patient has a severe deep overbite. In the lateral view, we can see the patient has severe overjet. And at back view, we can see the patient lower incisors bite to the upper palatal mucosa. So we know the patient has increased deep curval speed. The lateral view shows the patient very deep overjet and very deep overbite. So we know the patient has increased deep overbed, the severe deep overjet, and very deep curve of speed. We called these three depths malocclusion. Okay, the patient lateral profile shows the patient mandible is a retrusion, or we call the patient has deficient lower jaw. Why we say that? Let's compare with another patient profile. It's a very beautiful young lady. It's 22 years old. We can draw a vertical line from the subnasal point. So normally, the upper lip should be 2 to 4 millimeter in front of the line, and the lower lip should be on the line or 2 millimeter in front of the line. The chin should be 2 to 4 millimeter behind the line. So according to the standard, we can see our patient has a deficient lower jaw. The panoramic radiograph before treatment of the patient and the lateral cephalometric analysis of the patient, we can see the angle SNB, ANB, and SND were decreased significantly. So we know the patient has a mandible retrusion. So let's summarize the patient pre-treatment manifestation. We have the lateral profile, we have the lateral ceph, and the intraoral manifestation. The patient chief complaint is a deficient lower jaw and 3 depths. So how to treat this patient? As a title of the lecture, we use the SMARTY S8-SGTB. So the SMARTY S8-SGTB is a clear appliance with the positioning block. So let's see the animation of the phase 1. The main purpose of the phase 1 is mandible repositioning with teeth correction. So you can see I expand the upper dentition and I intrude the lower incisors to leveling the lower curve of speed and align the upper and lower dentition. Let's see the treatment progress. This picture is 1 month of the phase 1. So you can see the patient wear the S8-SGTB. The patient have to wear the appliance 7/24. That means the patient wear the appliance whole day long, including the meal. This is 3 months of the phase 1. I ask the patient to take off the appliance and take a picture. The 5 months of the phase 1. 7 months of the phase 1. And at last, the 10 months of the phase 1. Normally, the phase 1 is 9 to 10 months. So compare with the before treatment, we can see the upper dentition is expanded and the upper and the lower dentition were aligned. The frontal and the lateral view of the intraoral manifestation, we can see at the end of the phase 1, we correct the deep overbed, deep overjet, and improved the lower curve of the speed. The panoramic radiograph before and after phase 1. Can you see any difference compared with OPG before treatment? It's a very important question. It will help you to understand why the S8-SGTB therapy or stable? I'll answer this question later. The lateral ceph before and after phase 1, we can see the mandible advancement. Okay, after phase 1, we go to the phase 2. The main purpose of the phase 2 is reconstruct the occlusion. So you can see I extrude the posterior segment and retract the anterior incisors. So let's see the treatment progress. So compare with the phase 1, you can see we remove the block in the Smarty S8. It will help us to extrude the lower posterior teeth. The 3 months of the phase 2, you can see the posterior segment almost contact. The 6 months of the phase 2, the upper and the lower molar contact with each other. The finish of the phase 2, we correct the deep over bed, deep over jet, and we get the class 1 molar relationship. This is the final refinement. We do some teeth adjustment to get the better result. So this is finished, the intraoral manifestation. And this is a patient facial photos before and after. We can see after the S8-SGTB treatment, the patient lower third facial height increased. It led the patient facial aesthetic looks more beautiful. The smile before and after. And the profile before and after, you can see the significant change about the patient profile. The patient is very happy about the treatment result. The OPG before and after. The question is the same. Can you see any difference? And the lateral ceph before and after. After the treatment, we can see the mandible advancement. Okay, so after 20 months of the S8-SGTB treatment, we get a very good result. We get the class 1 molar and canine relationship, and we also correct the 3 depths, and we improved the patient profile significantly. I think it's a very high efficient treatment. Some doctor maybe think, is there any other treatment options? So let us go back to the patient 3D oral scan. The molar and canine relationship is typically class 2. So some doctor maybe suggest do the upper molar distalization to correct the molar relationship and to retract the upper incisors to correct the deep over jet. But how much can you correct by the upper molar distalization? I think the molar distalization, in my opinion, is the limit is 4 to 5 millimeter. But in this patient, if you want to correct from class 2 to class 1, you need maybe 7 to 8 millimeter. I think it's impossible or it's very difficult for the treatment option by the molar distalization. The next question is, what about the face? We all know the patient has a mandible deficiency. So if you retract the upper incisors, by the molar distalization, I think the patient profile will become more concave. It's not beautiful for the patient. The next treatment option may be extraction, but extraction in the upper or in both. Some doctor maybe suggest the treatment option is extract the upper four and use the extraction space to retract the upper incisors to correct the deep overjet. But how about the deep overbite? We all know it's very difficult to retract the incisors when the patient has very deep overbite. The next question is still, what about the face? Because the patient is the profile is concave. If you do the extraction treatment plan and retract the upper incisors, I think the patient profile will become more concave. It's not beautiful for the patient. So let us see some extraction cases of the three depths. It's a 22 years male. From the profile, we can see the patient mandible is retrusion. After 3 years extract treatment, the patient problem is not corrected, but the three depths became even worse. So how do? We do the mandibular advancement simulation and prepare for the S8-SGTB therapy. Another extraction case of the three depths is a male adult, about 26 years old. After 4 years clear aligner treatment, we can see the profile is still the mandibular retrusion. And the three depths was still very seriously. The OPG after 4 years treatment, we can see from the film, the lower curve of speed is very deep. And the lateral ceph after 4 years treatment, there is still very deep curve of speed, the very deep overbite and overjet. The third extraction cases is a very difficult cases, three depths. It's a horrible cases. It's a 24 years male. The patient began her first treatment in 2015. And after 4 years treatment, he can't get a very good result. So he transferred to the second doctor to begin the treatment at 2019. But after 4 years treatment, the result is not good. So the patient come to our hospital in last year to begin the third treatment. The profile is the patient at the second treatment. From the profile, we can see the mandible retrusion. And the three depths of the intraoral manifestation, the whole upper dental arch, and the lower right side missed 1 premolar. The OPG before second treatment, we can see the very deep curve of speed. And the lateral ceph before the second treatment. So from the last year, the patient come to our hospital, the intraoral view, we can see after 4 years, the second orthodontic treatment, the three depths become even worse. The second doctor chose to extract 3 premolar, the upper 2, and the left side in the lower. The OPG before the third treatment. And the lateral ceph before the third treatment compare the OPG before the second treatment, we can see the overbite increased. So how do we do to treat this patient? We remove the braces of the patient and do the mandibular advancement simulation to prepare for the third treatment. Okay, so compare with the 3 extraction cases. We know our first cases treated by the S8-SGTB is very high efficient treatment. But some doctors may be asked, is this occlusion stable? Is this result stable, especially in adults? Okay, let us see the case 2. It's a 33-year-old male. The profile shows the patient has a retrusive mandible. And the front view of the patient facial show he has decreased the lower third facial height. And the intraoral manifestation show the 3 depths. The OPG before treatment. The patient treated by using the SGTB. So what is the SGTB? Actually, the SGTB is a sagittal guidance twin block. It's a origin of the S8-SGTB. So the left picture is a SGTB, and the right is a clear SGTB. We call it S8-SGTB. They have the same structure. So let's see the structure of the SGTB. It will help you to understand the S8-SGTB. The SGTB has 2 parts. The upper part is bonded, and it has expansion devices. The lower part is removable, and the intersection angle of the upper and the lower part is 70 degrees. So let's see the mechanism of the SGTB. When the patient wears the SGTB, the mandible will move forward, and the reaction forces will push the upper buccal segment backward. And we use SGTB to expand the upper dentation to coordinate the upper and lower arch. And also we will get space by the expansion. Okay, here is a video about the SGTB. It's a very typical 3 depths patient. This is a SGTB. The upper part is bonded, the lower part is removable. So when the patient wears the SGTB, the mandible will push forward, and the reaction forces will push the buccal posterior segment backward. We do the upper dentation expansion to get space to align the upper anterior teeth. We can see the posterior area of the condyle. There is a new bone. It's very important to support the lower jaw to a new position. We also need to use the mini spoon to retract the upper anterior incisors. Okay, I think this video will help you to understand the treatment progress. Okay, let's see the treatment progress. It's 7 months of the treatment. The patient wear the S8-SGTB, and we put the braces on the upper canal to canal and align the upper incisors. At the 10 months of the treatment, we remove the S8-SGTB and we put the other braces on the upper and the lower. So you can see when we remove the S8-SGTB, there is a very huge open bed on the posterior segment. It's a reflection of the lower curve of speed. The comparison before and after, the patient profile has some improvement. Okay, this is an intraoral view of the manifestation. Compare with the 3 depths before treatment. We get a very good result and the class 1 molar and canal relationship. But the question is still, is this occlusion or is this result stable? Let's see the case 3. It's a 27-year-old male. The front view of the intraoral, we can see the very deep overbed. And the intraoral manifestation, so there is a 3 depths. So we use this S8-SGTB to treat this patient. After 10 months of the treatment, we remove the appliance of the S8-SGTB. There is a very huge open bed on the posterior segment. It reflects the very deep lower curve of speed. So we have to do some elastic to reconstruct the occlusion of the patient. Okay, this is the result pre and post. After the S8-SGTB treatment, we can see we get a very good anterior occlusion and class 1 molar and canal relationship. Is this result stable? So the question is why mandibular advancement by the S8-SGTB or S8-SGTB therapy was stable. Okay, so let's find some evidence from the very classical orthodontic textbook. These 2 textbooks is a very classical. We call the Bible of orthodontics. The one is a contemporary orthodontics. The other is a orthodontics current principle and techniques. So on the top of the slide, you can see which book and which page I choose from. So the first question is why do functional protrusive appliance increase the mandibular growth rate? The answer is the functional protrusive appliance increase the mandibular growth rate because of the mandibular condylar cartilage. It's very important. Okay, let's see the page 18 from the chapter 1, the orthodontic current principle and techniques. The growth of the mandibular condyle tends to be relatively highly responsive to the mechanical, functional, and hormonal stimuli both at the time of development and throughout the growth period. On the next page, we can see even in adults, however, it is not unusual to see areas of hyaline cartilage, we called cartilage island, deep to the articular layer in the condyle. And at page 103, the chapter 4, within the physiological limits, the TMJ has remarkable regenerative and adaptive capabilities. the TMJ can recover spontaneously from degenerative episodes. So let's see the figure 4 to 13. The superimposed tracing of the series of panoramic radiographs documenting the degeneration of the mandibular condyle between 13 to 18 years age. So from the picture, we can see at the age of the 13, before orthodontic treatment, the shape of the condyle is in the black line. So the condyle shape is very good. But at the age of 18, after orthodontic treatment, the shape of the condyle in the blue line. So we know there is a degeneration of the patient mandible condyle. But between the age of 18 to 25, the degenerative condyle grew, restoring the original length of the mandible. So at the age of the 25, the shape of the patient condyle in the right line, it restoration the original length of the mandible. So from the patient, we know the TMJ has remarkable regenerative and adaptive capabilities. The TMJ can recover spontaneously from degenerative episodes, even in adults. And Professor Shen published the review article, Cephalometric Evaluation of Condyle and the Mandibular Growth Modification. And in 2005, the Professor Shen published a very important article named The Adaptive Remodeling of the Condylar Cartilage, a transition from the chondrogenesis to osteogenesis. The paper published in the very famous journal, the JDR, because the paper is very important. So the image from the paper was selected as a cover image. Also, the Professor Shen published some case report of the SGTB. This is one case report. This is another case report. So let's go back to the classical textbooks, the contemporary orthodontics, the page 457, the chapter 14, the potential effect of the functional appliance therapy for correction of the class 2 skeletal malocclusion are illustrated here. The most desirable and variable effect is for the mandible to increase in length by growth at the condyle, the green arrow. And the chapter 4 of the orthodontic current principle and techniques show the growth-related condyle modeling in the 9 to 16 years old male is still in the condyle, the right arrow. So let's simulate the S8-SGTB therapy. When the patient wear the S8-SGTB, the appliance will move the mandible downward and forward. So at the superior and posterior area of the condyle, the cortical bone of the area will stimulate by the continuous mechanical force. As this force, the cortical bone of this area will appear adaptive remodeling. So there is a new bone. It will support the mandible at the new position. So is this occlusion stable? Let's see the case 3. It's a OPG after the SGTB therapy. Please look at the superior posterior area of the condyle. You can see the new cortical bone. So let me draw with the red line so you can see the new cortical bone very clearly. So the patient start his treatment at 2015 and finish treatment at 2018 and 3 years follow-up at 2021. So we can see the result is very stable. And the OPG pre-treatment, the OPG after treatment. So now you can see the newborn at the posterior and superior area of the condyle, and the 3 years follow-up. The lateral self of the patient pre-post and the 3 years follow-up. The result is very stable. The facial profile before and after and the 3 years follow-up. Okay, let's go back to the case 2. Is this occlusion stable? Let's check the OPG of the patient after 7 months SGTB treatment. Compare with the OPG before treatment. So please look at the superior posterior area of the condyle. You can see the new cortical bone. Let me draw in the yellow line so you can see the new cortical bone very clearly. Okay, let's summarize why the S8-SGTB therapy was stable. When the patient wear the S8-SGTB, the mandible were moving down and forward, so the superior posterior area of the condyle will stimulate the continuous mechanical force. The cortical bone of the area will appear adaptive remodeling and readjustment between the condyle and the fossa. This new cortical bone will supporting for the mandibular advancement. Because the lecture is just only 1 hour, so I have no enough time to show the full cases. So let me show some cases, OPG before and after. This is a 13 years female. So after the S8-SGTB therapy, we can see the new cortical bone. And this is a 16 years male. So after the S8-SGTB therapy, we can see the new bone at the top of the condyle. A 19 years female. So after the therapy, we can see the new cortical bone. We call it double contour. The 24 years female, after the S8-SGTB therapy, we can see the double contour on the top of the condyle. This is a very difficult cases because this 26 years female experienced the degeneration of the condyle, but after we use the S8-SGTB to treat the patient, we can see the new bone on the top of the condyle. This is another doctor, not in our orthodontic team. It's Dr. Liu from Guangzhou, China. It's a 24 years old patient. So after the treatment by using the S8-SGTB, we can see the new bone on the top of the condyle. A 21 years patient from the Dr. Wu. After the post-treatment, we can see the new bone at the posterior of the condyle. The 31 years old patient, after the S8-SGTB therapy, we can see the new bone on the top of the condyle. Okay, a lot of doctors learn from us and treat these 3 depth patient by using the S8-SGTB. They get the very beautiful result. So they publish the result on the internet. Let's see some evidence from the CBCT. It's a 24 years female. So after 7 months of S8-SGTB therapy, we can see the new bone as the posterior superior of the condyle. The superimposition of the condyle before and after treatment. The green is a pre-treatment. The red is a post-treatment. So we can see the new bone as a posterior superior area of the condyle. So let's go back to the case 1. I have been asked the question, can you see any difference before and after? So now you can see very clearly at the posterior area, there is a new bone. Okay, let's check the patient CBCT. The red TMJ pre-treatment, post-phase 1, post-phase 2, and post-treatment. You can see the new bone on the posterior area of the condyle, and also you can see the readjustment of the condyle and the fossa. The left TMJ, the pre-treatment, the post-phase 1, post-phase 2, and post-treatment. So what's the indications of the S8-SGTB? The Professor Shen has a diagnostic classification for the malocclusion with facial prognosticism. The facial prognosticism can divide it 5 types. It includes the fundamental dental alveolar, the fundamental skeletal, the mandibular retrusion, dental alveolar, and the mandibular retrusion skeletally. Because the time is limited, so I have no enough time to explain the detail. But these three types, we use S8-SGTB to do the treatment. It's a clinical manifestation of the three types we treated by using S8-SGTB. Here is a simplified classification for facial prognosticism. I suggest you take a picture so you know these 3 types is an indication of the S8-SGTB. So let's summarize the indications of the S8-SGTB. It's a facial prognosticism with retrusive mandible. It's a class 2 molar relationship combined with the 3 depths. Okay, let's see the history of the mandibular advancement. From the textbook, The History of Orthodontics, our professional history can date back more than 2,000 years. So to be an orthodontist, you should be very proud. And on the chapter 9 of the textbook, we can see the history of the functional appliance can be traced back to 1879, when Norman Kingsley introduced the bed jumping appliance. So the functional appliance to correct severe class 2, the history is more than 150 years. Our professional founder, the Edward H. Angle, also used the non-compliance functional class 2 corrector. From the classical textbook, we can see a lot of design of the functional appliance, such as the Bellnator, the Franco 2, the classical twin block. The intersection between the upper and the lower is a 45 degree. Its difference with the SGTB. It's a bonded herburst. And the Mara, the Fossas appliance is a fixed appliance. and the SGTB. At last, it's a S8-SGTB. So why we choose the S8-SGTB to treat the three depths? The reason is when we move the mandible forward, the meantime we can do a lot of teeth correction. So it will save the treatment time. So to answer why we choose a Smarty S8-SGTB to treat the patient with three depths, let's see how Smarty S8-SGTB works. The left is a bonded SGTB. The right is a Smarty Clear S8-SGTB. They have the same structure, but the mechanism is a little bit different. The disadvantage of the fixed SGTB is when we remove the appliance, there will be a very huge open bed on the posterior segment. Another example can show the very significant open bed on the posterior segment. There is two similar cases, the one treated by the SGTB, the other treated by the S8-SGTB. So after 10 months treatment, remove the appliance, we can see the patient treated by the SGTB, it has a very huge open bed on the posterior segment. But the patient treats S8-SGTB, the open bed is very small. So the total treatment of the patient treated by the SGTB is 21 months, and the patient treated by the S8-SGTB is only 13 months. So why the treatment time is a difference? I think because the S8-SGTB repositioning the mandible and correcting the malocclusions simultaneously. Or we can see the S8-SGTB moves the teeth efficiently, meanwhile repositioning the mandible. So let's see the S8-SGTB move the teeth efficiently. The main mechanism is expansion, molar distalization, alignment, and leveling the curve of the speed. So the expansion, why we do the expansion when the mandible relocated to the forward? Because we have to coordinate the width of the upper and the lower. We have to establish the normal posterior tooth stalk and obtain the space for alignment. The left blue one is an upper dentation. The pink color is a lower dentation. So when the patient has a mandible retrusion, the occlusion is like this. So when the patient wear the S8-SGTB to move the mandible forward, the occlusion like this. So we know the width of the posterior segment is not coordinate. So we have to expand the upper dentation to coordinate the occlusion of the upper and lower. Also, we use the S8-SGTB to correct the posterior tooth stalk when we expanded the upper arch. And we also get a space for alignment. The next mechanism is molar distalization. We do the molar distalization for adjusting the relationship between the molar and the canines and obtain the space for alignment and obtain the space for retracting anterior teeth. Okay, sometimes when we do the mandible relocation or repositioning, the molar relationship is still class 2. So we have to do the upper molar distalization to let the molar relationship from class 2 to class 1. But sometimes when we relocated the mandible, the molar relationship became class 3. So we have to do the lower molar distalization. Let's see an example. It's a very beautiful young lady. Her chief complaint is a mandible protrusion, but her molar relationship is a class 1. So we move the mandible forward by the S8-SGTB, but the molar relationship from class 1 to class 3. So we distalize the lower molar by using the mini screw to get from a class 3 relationship to class 1. And the next mechanism is alignment when the mandible relocated to the forward. We close the anterior space and establish the positive chalk of anterior teeth and remove the interference factors of serous crowding. It's a very typical 3 depths with anterior space. So at the phase 1, when the patient wears the S8-SGTB to move the mandible forward, we close the anterior space. The anterior space was closed. And another very typical 3 depths patient, as a post of the phase 1, you can see from the picture, we correct the anterior teeth talk. The last mechanism is leveling the curve of the speed. Because we know after the treatment by the SGTB, there is a very huge open bed in the posterior segment. It's a reflecting of the lower curve of speed. So when we design the S8-SGTB, we hope to leveling the curve of speed very efficiently. So we have 3 designs. The first is we do the anterior intrusion like this. So when we remove the appliance, the open bite on the posterior segment will be very small. The next design is we decrease the height of the block gradually. It will help to extrude the posterior teeth. It will help leveling the curve of speed. So at the end of the phase 1, we can get very small open bite in the posterior segment. The next design is a posterior teeth extrusion with elastic. Okay, because we just have 1 hour lecture, so let's summarize the lecture. What is the Smarty S8-SGTB? The Smarty S8-SGTB is a clear version of the SGTB. It has positioning block. When the patient wear the appliance, the patient has an improved profile and correct the 3 depths. The S8-SGTB in vitro and in vivo. And what's the indications of S8-SGTB? Facial prognosis with retrusive mandible, the class 2 molar relationships, and with 3 depths. Let's see some cases. It's a very typical 3 depths patient and very severe. The first visit, and the patient wear S8-SGTB, and at the finish, we get a very good result. The patient profile before and after. Another very severe 3 depth patient, the patient treated by the S8-SGTB. So at the end of the treatment, we can see the patient has a very good result. The profile before and after. The last patient is a 3 depths. It's a very severe deep curve B and treated by the S8-SGTB. So at the end of the treatment, we also get the very good anterior occlusion and class 1 molar and canine relationship. The profile before and after. So why SMART-T S8-SGTB therapy was stable? Because when the patient wear the S8-SGTB, the mandible will move downward and forward. The posterior and the superior area of the condyle will stimulate by the continuous mechanical force. So the cortical bone of the patient will appear adaptive remodeling and readjustment between condyle and fossa. The new cortical bone will supporting for the mandible advancement. Okay, the last is how SMART-T S8-SGTB works. I think it's a very useful to treat the patient with 3 depths because the patient when the patient wear the SH, the repositioning the mandible and correcting the individual teeth simultaneously. So the STB is very high efficient.